Today's roundtable is all about bringing together oral health and general health or systemic health and the links between them. And we're really pleased that we've got a fantastic range of different organisations representing different disease areas, different health professions and different policy actors in this space to bring together all of their expertise and see what we can learn from each other.
What are the main barriers to integrating oral health and systemic health in global health policies and practices?
So the first barrier I would say is integration at a real systemic level. So for example, if we look at the way that public health departments are structured, a chief dental officer, for example, or an oral health team, they might sit quite isolated away from the other health topics. So for example, something more generic about NCDs or even diabetes, maybe they don't operate in collaboration with each other. And so really from that top level, and there's no clear communication. So then having that trickle down at a professional level as well, I mean, the system doesn't set up to favour that kind of interprofessional collaboration.
What are some successful examples of integrated oral health programmes or policies that can be expanded to other settings?
Coming from the UK, most of the examples I have are fairly UK-centric. However, they can be considered in a more global context. And my own work actually looks at utilising dental practices to deliver preventative advice for shared risk factors for both oral health and systemic health, as well as utilising the dental team in order to risk assess and identify those who may be at risk of diabetes. And the preliminary findings of this are really positive, with about 15% of people who are walking through dental practices perceiving themselves to be healthy actually being at high risk of pre-diabetes and diabetes. So utilising the whole healthcare team to make every contact with healthcare professionals and the public count is a really important concept.
What role can education and awareness raising play in promoting oral health and preventing systemic disease?
It's important to be aware that both obesity and oral health as diseases need to be addressed in a comprehensive way through integrated action. We may address obesity and also be addressing common risk factors for oral health, including stigma as a very important social determinant of health.
How can oral health professionals collaborate more effectively with other healthcare providers to promote integrated care?
Firstly, I think it is important for all healthcare providers to be aware of the implications to general health of oral health and oral disease, and to embed those into their practice and make every contact count with patients. Pharmacists are taking on an increasing role in primary healthcare, in health education, in disease prevention, and for example in the prevention and management of non-communicable diseases. So for example, when patients come to collect their medication for diabetes or hypertension for other non-communicable diseases, it is important to assess their situation in terms of oral health, to identify any symptoms or even any red flag symptoms that may require a timely referral to an oral health provider or dentist. So those are some of the ways in which pharmacists can contribute, also by empowering the community and the public to self-care in terms of oral health, in terms of adopting an adequate oral hygiene and also dispensing and advising on the use of oral health products that are available at pharmacies.
How can policy and regulatory changes be used to support greater integration of oral health and systemic health?
A lot of the policies and regulations that are relevant for both oral health and more general health are actually the same quite often. So that includes a lot of policies to reduce exposure to common risk factors, such as the marketing policies, such as labeling policies, and also taxation on unhealthy products, such as tobacco, alcohol, and sugary foods and drinks. So I think it's also important to mention these policies are population-wide. It means that it helps improve equity for both health and oral health, and also very importantly, they are effective but also cost effective, so they have a huge return on investment in the population. And we need to take all this together to build awareness that these policies are important for both general health, oral health with a unified voice.
How can international health NGOs and other stakeholders work together to promote greater integration of oral health and systemic health?
The reason why I came to this meeting is to find interdisciplinary cooperation opportunities between the associations and to improve the quality of life of our patients. Every 10 patients who are stepping into our dental office has living with diabetes statistically, which means that dentists need to understand the complications of diabetes, and also the patients need to understand why they need to go to visit dentists every year.
We have a global voice in terms of policy that we could put together with other healthcare professionals. That's number one. The second thought is we also need to have really a strategic direction on how can we make sure that the message is delivered to our members and being disseminated to the community. That's the goal in terms of oral health and what we want to achieve.
I think the main thing we need to do is prioritise tackling the risk factors, particularly sugar and sugary drinks. We know that sugar is a very important risk factor for tooth decay, diabetes and obesity, not to mention a whole lot of other NCDs. So in terms of prioritisation, if the FDI World Dental Federation can collaborate with other NGOs, then it will make a big difference in the long run.
We are, as a primary healthcare, the point of entry in the system. So that means we see and we assess a lot of oral health problems. The opening and the facilitation to open to the next step, which is the referral, it seems to be lacking right now, since it's not universal health coverage topic, and a lot of time they do have to pay for the services of the dentist. There seems to be a gap. Even though we want to communicate, it's more on the fact of the pathway that the patient will take.
Can you please tell us about the importance of integrating oral health within self-care?
So self-care is nowadays a component that we cannot avoid or ignore from the healthcare continuum. And oral health is one of the crucial parts as well of self-care. So at the Global Self-Care Federation, we are creating a momentum to have a resolution on self-care being adopted at WHO. And having oral health being part as one of the key factors to enhance self-care, to empower individuals, will really support our effort and gather all the key stakeholders from the different healthcare professionals and different organizations to push for the same message.
Well, one of the really important things about today was networking between all these different people and organisations. And I think actually the conversations today have started a long and fruitful relationship that we'll hopefully be able to build on. When we advocate for things, then I think if we're all advocating as individual organisations, that will have a certain effect. But actually if we can all advocate with one united voice, that will be much more powerful. And that's something I really hope we can take forward.